In this, a conclusion to our Marfan Awareness Month campaign, we asked Professor John Pepper, consultant cardiac surgeon at Royal Brompton Hospital, to explain why early diagnosis of Marfan syndrome is so critical in the context of the heart. So, why is early diagnosis of Marfan syndrome so critical in the context of the aorta?
Well, it is preferable to detect problems early in medicine, and particularly in a genetically driven disease like Marfan. If we can identify that the patient has got a Marfan and we diagnosis, and we can examine the aorta, then we can plan to intervene and stop the aorta expanding any further at an early stage and do a much simpler operation, which, in other words, an operation that carries a lower risk and lower morbidity. Likewise, if because of Marfan, the aortic or the mitral valve, or possibly both valves, are beginning to leak, the earlier that we can detect that, the more simple it is to repair the valve. If you can repair the valve and keep your own valve, that's the best solution. But if things are allowed to go on for 10 years or more before any action is taken, the disorganization of the valve may be such that it's not possible to get a good repair, and then you have to replace it. We've got very good valves for replacement, but they're not as good as your own valve, because the choice is either between a valve that's very durable, but for which you have to take lifelong anticoagulation with warfarin, or a biological valve, which is very satisfactory early, but after about 15 to 20 years, it will degenerate and need replacing. So if we can repair valves, that's by far the best solution, provided we can get a good durable repair, because we've intervened early before the valve is very, very disorganized. So those are the reasons, I think, why early detection of Marfan is important.
And also the danger of death and aortic dissection, because sometimes they're not heralded by pain. They can arrive.
Yes, a dissection can sometimes not be heralded by pain, and it can be silent. And then that's very difficult to diagnose. But if you already know that the patient has Marfan syndrome, then you should be far more alert. And there is, interestingly, an ethnic difference here, that in Hispanic and Asian people who have Marfan syndrome, often the musculoskeletal aspects of Marfan are very minor. So they don't have a particularly twisted spine. Their hands and their feet are not particularly abnormal, but the Marfan can affect the eyes and it can affect the aorta. So when you see the patient for the first time, it's not obvious to the doctor that they might have Marfan syndrome, but you need to be alert. And again, Marfan genetic testing is important so that you can understand exactly what's going on and you can give appropriate advice and advise on correct treatment.
That's perfect. Thank you very much. Thank you.
Okay. Is that it?
That's it. I'm going to stop recording.